Oakland, California. Population over 400,000. In 2011, more than 1.2 million Americans were living with HIV. Many are unaware that every day companies like Abbott, HepPAC, Children's Hospital, AIDS Healthcare Foundation, and many other organizations are fighting to prevent the spread of disease through education, preventative services, as well as treatment options. It's April 29, 2015, and representatives from each of these places have gathered to update each other on their efforts and discuss new avenues to create an AIDS-free generation.
Really nice to see familiar faces. Nice to see Marsha again. You know, a lot of times we're meeting around different states, but it's good to have Marsha back here in Oakland where it all started. So again, I want to welcome everybody. I believe in what we're doing. I've been on the board now for about 2 years and just gonna renew for another 2 years because I believe in Uchaps. So I just want to welcome everyone. Thank you.
No, I'm Kathleen Clannon, and I work for the County of Alameda and the Healthcare Services, and I am an HIV doctor.
I am Jesse Brooks. I'm HIV positive myself. I fight stigma. I'm on posters. I'm a journalist for the Post News Group, and I'm also an advocate coordinator with the AIDS Health Foundation.
I am Bronze Courtney. I am a program manager with HepPAC, which is the HIV Education Prevention Project of Alameda County, and also with Main Vein Productions, as well as BARS, which is Being Aware, Ready, and Safer.
My name is Jennifer Shoup. I'm with Abbott Diagnostics, and I'm a senior product manager in U.S. marketing.
Jay Fournier, I'm with AbbVie.
I got asked today to talk some about how medical care for people with HIV has changed over time. And it made me, getting ready for today, made me remember about how it was in the old days. I started taking care of people with HIV in 1984, and it was a terrible, terrible time. And today I got the chance, with a room full of people who care deeply about this, to remember those days and think about how far we've come.
We typically talk to laboratorians and pathologists and those in the lab, so it's great to speak to those community leaders and those folks that are out, on the streets that can really make a difference.
I like today's events because, of course, we get all the major players in the room and we get to talk about coordinated services and best practices from every level, from the people on the street to the people who are retaining the individuals we're looking for to the medical providers in the federally qualified health clinics. And so we all need to work together as a group to make sure that the people with the highest risk for HIV and hepatitis C are well taken care of and have all the resources at their fingertips to get care.
In Alameda County last year, Focus tested 36,000 individuals. That's a positivity rate at 0.04. But it's really not about that. It's about trying to routinize testing. It's about making sure that we use the latest technology, and it's also about identifying people who are positive and getting them to care. Folks are invested in expanding testing. Our question, and one of the reasons we wanted to hold this community update, is how do we ensure that testing is moving along and we're using the latest technology? What can the community do to make sure that we are using the best that we can?
Rapid testing program is actually an advocacy initiative that we launched globally, primarily to influence government policies and make some changes in terms of how folks were accessing testing. The model is to create a marketing campaign to provide free accessible testing, to either provide group or brief one-on-one pre-test counseling. We use rapid testing across the board, make sure everyone gets the results on that day, give them condoms, and link them to care directly when they get a positive result. We do this in Asia, Africa, the Americas, and Europe. And one thing I want to draw attention to is the growth between 2012 and 2014.
Was that us testing agencies are learning from our testing strategies around HIV, and one of the things that works is making sure that testing is available in existing programs. Co-locating, I think that's the buzzword about it.
We don't care why you retested again, we just want to know that are you in care now. So our objective is to, okay, it's okay, you already knew, what is your next steps? And then we start going to some more motivational interviewing of what is it that's been keeping you out of care of HIV and how can HepPAC as an agency help you. We have something called the Red Carpet Service, which is a van that literally you need to go cash your check, you need to go grocery, you need to do all this before you get to your medical appointment, then we will take you, and that happens a lot. But it takes a lot of time. And we don't have a person allocated to just, literally hold a person's hand through the whole process throughout the day, but we find ways to do that at HempAct.
What was really important was that we found this issue where people test over and over again. So we found some new positives, but we also found a lot of positives that actually already knew they were positive. Isn't a bad thing, or was this a good thing because we're relinking people to care? And it kind of sounds like maybe you guys have weighed in and it feels like it's a good thing because you're re-engaging people. So you lose the cost of the test, but you re-engage them with care, which sounds like a good public health strategy.
We have a staff of 6, and they wear many hats. They're the HIV tester, they're the short-term crisis counselor, they are the linkage and retention specialist. I mean, it's just...
The volunteer coordinator, they're the cook, they're the...
already feel disenfranchised and have fear around going to the doctor to ask their doctor. That's a huge task.
Yeah, it's funny you bring that up because Abbott did do a whole pilot program in the primary care setting where we came up with a whole educational guide, toolkit if you will. Half of the materials were for physicians and the other half were for patients so that we could prompt that discussion, that dialogue. So it came with posters, it came with counter cards and trifold brochures, and then there was the clinical research and papers for the physicians.
I read an article that was questioning why are we so worried about testing when we can't even engage the positive that we know into care. So I think a lot of the work is not only getting folks into care, but retaining them in care.
But I think we did an outdoor ad campaign, right? And so that was kind of when I first started getting involved in this level. But because I have so many folks in my community who've been affected, that this has just been something that's been a part of my life for a long time. So thank you for the work. I'm gonna leave my cards here. With anybody who want to reach out to me, I am fully available for you. Sit down and talk about what we can do from the mayor's office to be supported in these efforts. So thank you. Thank you, Marsha.
Thank you, Peggy. And in fact, Peggy's involvement with Clear Channel really helped us begin to do some of our social marketing in the early days, and that model can help to move systems to better help us reach people in the community. So thank you, and we're happy that you're in the mayor's office.
Thank you.
We get treated for HIV here. We get tested for HIV here. We have spent that time in Oakland, and we've spent that time in the other Oaklands around the country trying to create an environment where getting tested for HIV, knowing your status, being treated for HIV is an okay thing to do. If you could walk into the lab and just decide, or walk into Planned Parenthood and just decide I'm going to get an HIV test today, would that help?
We have to get those champions like Dr. Ann at Oakland Children's to really take their programs and implement them.
You know, Children's Hospital used to be Children's Hospital Medical Center of Northern California, and then it became Children's Hospital Oakland, then it became, it's had 6 names since I've been there. The latest name is UCSF Benioff Children's Hospital Oakland, but we're still the same group of people. I'm going to talk to you a little bit about what we've done with HIV testing. So we made efforts since the 2006 CDC guidelines came out to follow the recommendations to expand testing, but it was extremely difficult for us to do. We did start seeing a few more patients with HIV diagnosis in the community, and we realized that we've got to do a better job, but we didn't have a way to push it in each of these 7 sites, and I'm physically in one place and those sites are in 7 different locations.
Anne was recently admitted to the Alameda County Women's Hall of Fame.
Yes.
If you need to hear a funny story associated with it, Mayor Schaaf came to me, having figured out who I was because of that presentation, and said that when she was little, living in Oakland, her mom was the head of volunteers at Children's, and we had fun activities for kids, and one of our days was a bunch of foster kids getting to go to the zoo. And she went along with her mom and these kids. And she said, there was this really cute kid there, and she told me about him. She said that he was bitten by a yak when he was there. And I remember that, and she remembered his name. And I said, well, turn around. And there in the audience was my 25-year-old patient who was that 2-year-old bitten at the zoo. So Mayor Schaaf is more tuned into HIV kids than you can imagine.
You know, something that Kathleen Clennon said that really struck me is that we really need to do more focusing on public health.
What I'm really excited about seeing is the 4th generation testing that Abbott is doing and how advanced that is actually going to become in the future, where people that represent my agency who are on the ground running, testing counselors, are going to be able to provide the antigen tests.
Like bringing it all together, because I think, as we all know, it takes a village and a lot of work to make a difference. So it's these kind of events that I think will help us.
We really need these 4th generation tests right now so that we can stop new infections. Because right now we're in a state of emergency around HIV and AIDS in the Black community.
I really believe that we're in a place where if we are bold and brave and willing to break some stuff, that we could be looking at an AIDS-free generation 13 to 15 years from now. I believe that we can make it. And I think the people who are in this room today are going to help us get there.